Hey, all you Dad Shoes listeners out there. We have a very special guest for our episode today. We were finally able to nail down an appointment with our good friend, Dr. Eric George. Dr. George is a pediatric ER doctor that is local to our area, and we were super excited to talk to him and have him on, ask him all the questions that you want to know as parents. Now, this episode did run very long. We recorded for over an hour and a half, so we've decided to split this up into 2 episodes. So, this first part will be about 45 minutes, and then we will release the next 45 minutes next week. One final note, due to the nature of how this episode was recorded, we were very limited in what we can do in our editing, so we do apologize for any extraneous noise you may hear in the background. It may be a little more distracting than our usual episodes, but we thank you for your patience. Now, here's the first half of our conversation with Dr. Eric George.
Hey guys, welcome to the Dad Shoes podcast, the dad group you don't have to go to.
And isn't that a wonderful thing? You know what's this wonderful thing, John?
What?
Keeping promises.
Keeping
And we made a promise.
promises.
We made a promise to our listeners that we were going to have some guests this year. And so far, the only guest we've had is my wife.
Hey, that was a good
great.
episode.
Which was great. Awesome episode. We talked a little bit about organization. And that one, we also talked about kids in sports programs and stuff. But
I think so.
we don't want to get too far into that. We have another guest here tonight, a longtime friend of ours from way back in the day, who's gone and made himself the top doctor that I know.
I'll take it.
With friends. I don't want to
go on.
Go on. And Mr. Eric George. So thank you for joining us.
Thank you so much for having me.
We're really looking forward to this one. We've been trying to schedule it for a while. And we actually, listeners, if you've been with us for a while, you have probably heard the episode we did with your sister, Eric. We did an episode with Anna because child psychology. And so we got to talk about how weird our kids are and why we just need to let them throw things sometimes, even when it doesn't make sense.
She's got a lot of good things to say.
I should go back and listen to that episode again.
I never listened growing up, but now I listen a lot.
You know, it's weird. My brother and I, we weren't very close at all, at least after I was in high school. And I swear, that kid's got some gems. And I mean, I still call him a kid. He's in his 30s now, and it's like, God, he's got some little gems up there. And
yeah, well, you know what? I don't want to brag on your brother, but when you're making MCU movies, that's pretty dang successful.
I think so.
If there's anybody we know that I think has made it, that's pretty good. That's pretty cool.
That is pretty cool.
I don't know. I think our current guest is also come
absolutely.
pretty far in the world.
Absolutely. I'd say Eric has made it too, just by all that time you spend in school.
Oh my goodness!
It's you make a career after out of being in school.
So on that topic, how old are your kids?
We had a 4-year-old daughter and a 2-year-old boy.
Awesome. Yep.
That is
Eric
awesome.
is also a dad as well, so very appropriate for the dad shoes.
Yeah.
So we'll talk about dad topics, doctor topics. So Eric is a pediatric ER doctor. Is that appropriate title?
That is.
So we wanted to have him on to kind of talk about, when's a good time to bring your kids to the doctor? What should we be looking at? Now, it's crazy right now with all the different coughing viruses going around and flu-like symptoms. And preschools are really just dirty places. If you think about it.
We fondly, I guess most pediatricians have fondly designated the recurrent viruses that kids get. We call it daycare syndrome. So anytime you've got yeah, exactly. It's a well documented syndrome, daycare syndrome. And the classic is my child's had a cough and cold for 4 months and they get better for a few days and then it comes right back.
Oh, thank God. I'm so glad you're saying that. Because Monday, I was at the doctor, at the pediatrician, and I'm like, doctor, the 3-year-old, my 3-year-old, she has been sick since we started preschool. And he's like, yeah, usually it comes and goes. I'm like, no, it's like it's here, and occasionally we get a reprieve. But she's had the sniffles since June.
Yeah.
So I'm glad you say that.
My kids aren't even in daycare, and they've been sick since Thanksgiving. Well, we get 2 or 3 days of them being somewhat back to normal before they get sick again.
Oh, man.
Then it restarts the timer.
Do you take your kids to the doctor? I mean, I guess you have to.
So, yeah, I guess.
After I asked that question, I realized that was really dumb, but still.
It's more of a complex answer than that. I try not to treat my own kids.
Right.
Like there's times like we're on vacation or when we were moving down here in between having pediatricians established. That's always when stuff happens, right? When you're moving or you're on vacation, crazy stuff's happening. So if that's the case, I take care of it myself. But I try not to because it's important to have a non-biased third party being able to take care of your kids. Because as a dad, you really, whether you're a doctor or any other specialty, when it comes to your kids, you have a biased view.
Sure.
So it's always good for your kids to have someone who's not you taking care of them.
Yeah, that makes sense. And really quick aside for Eric before we get too far, we go back and forth in terms of like privacy and whether or not we want to say our kids' names or our wives' names. And I think right now we're more on the like my wife, my son, my daughter trend. So just so you're aware, well, it's up to you, but I don't know. I maybe we're worried about nothing. And there's definitely episodes where we've said our kids' names and wives' names because we had a forget about it season. But I think we're kind of back and like maybe it'd be a good idea to not, just as we're recording, and we can.
I was gonna say I'll go with whatever you guys have. So I'll just say my wife, my daughter, my son.
I don't know if that's gonna be confusing for listeners, but whatever.
If it will slip up occasionally, but.
You just immediately follow it with my son.
Right. Right.
And then we can just clip it,
Sounds good.
Just cut it right out. So.
The beauty of editing.
Oh, man. It's great.
Yeah.
I'm looking for questions that I texted Connor for you.
About this?
Yeah, I don't remember where I put them.
Well, I mean, let's start with the basics. Let's start with the dad stuff.
Well, and I'm happy to ramble, too. I have a million soapboxes I can stand on.
I've heard a couple of them, and I love it.
The poor residents who work with me that I teach every day, they have to listen to my me standing on a soapbox.
Well, and I just picture as you say that, we all love Scrubs, like the old show Scrubs. And when I was younger and I watched that show, like. It made me want to be a doctor, and then I just convinced myself like there's no way that's what it's actually like. And I've kind of come to in recent years here that no, it was actually somewhat accurate. Like maybe not all of the hijinks, but when it comes to like, because they felt and dealt with like some really heavy topics, they would not save a patient just for the sake of the story. If they needed, for a happy ending, they would kind of deal with those hard topics and the reality of being in a hospital all the time. So
yeah, Scrubs is a very accurate. I mean, there's things there's obviously the dramatic bits and stuff.
Yes, of course.
That are maybe not as much, and certainly the romantic aspects of Scrubs you don't really see too much. It still happens, but not like that.
Mm-hmm. You haven't found anybody to like jump in their arms and yell "Eagle" at your hospital
yet? My college roommate. We would do that, but he ended up being a pharmacist. I was really disappointed in him.
So
surgery, man, surgery.
Aren't pharmacists like they're doctors without the residency?
Yeah, exactly. I really wanted him. I was going to be JD, and he was going to be Kirk, but he ended up being a pharmacist.
Oh man, quitter.
Oh well,
exactly. What a quitter.
He's probably making so much money right now.
You know what they call him? Doctor.
There you go. Yeah.
There you go.
But anyway, back to your soapbox, I just picture you as like Dr. Cox just yelling, at the interns, like, we don't need to be giving them this kind of medicine anymore. Like, let's move on into the future.
I like to think I'm a little bit of JD, a little bit of Dr. Cox, and a little bit of Bob. So
it's a happy medium.
I have those days sometimes.
Gosh, I'm gonna have to find Scrubs and watch it now. Oh man,
I have.
Great show.
It's probably. I think it's on Hulu.
Or
But-
Netflix. Might be on Hulu.
Anyway,
Anyways,
well, do you
not
want to
the
start with your soapboxes? Like, you want to give us a taste of a soapbox, or do you want to talk about being a dad?
It doesn't matter to me, man. I'm here for the party.
What's your like spiciest hot take soapbox?
From a parent perspective, it's just good to have a doctor. A pediatrician should be doing this, but the realistic aspects of medicine nowadays, there's so many things that pediatricians are expected to do in a 15 or 30-minute window. It often just gets left aside. And there's lots of things I can say about the modern state of medicine, but a lot of education that should be done by pediatricians often don't get done. And it's not anyone's particular fault. It's just too many expectations for too narrow of a window, appointment window.
Oh.
So a lot of basic education can prevent a lot of ER visits. Number one thing, and I see it more here than I did in Alabama, is fever is not an emergency. So I have some patients come in and parents rush their kids into the ER carrying them, and I ask what the issue is and how can I help them. And chief complaint is fever for 2 hours.
Amateur.
But I understand. I understand it. Back in the day, that we used to say that fever is dangerous, right? They used to say fever is bad for the brain and it can cause seizures. Now we now know since like the 1960s that that's a myth, but a lot of people don't know that. And that fever is not a reason to bring your child. Fever alone is not a reason for you to bring your child to the emergency room.
Yeah.
Start by getting ibuprofen or Tylenol.
Yeah, well, and I know that our pediatrician has probably said that to us before. And our pediatrician has a couple of lovely services that really help, where you can call in and like leave a voicemail of a concern, medical concern or whatever, and then they'll get back to you when they can. So like we just called just this week because potty training, just looking for some advice on that. Our 3.5-year-old does not want a toozy on the pot.
That's a tough one.
We're looking for a little advice, and I don't think I got a call back from them, but they have like the portal online, so they send us some information on there and like, hey, we got your call. Here's some articles you can check out. But like really cool if it's just a minor concern. Like I'm not going to bring her to the doctor for that, but I can call, and it didn't cost me anything. Just being a patient allows that to happen.
I think great. One thing that I have found I really love is the telehealth visits, and I've done it more for me than the girls, but we ended up doing one for our the 3-year-old. I don't remember what the issue was, and the doctor prescribed the antibiotic and something else for her, and that was it. It was great telehealth. I had like a strep thing, and I videoed the doctor, and the doctor was like, yep, it's this, gave me steroids and antibiotics, and that was it. No copay, nothing. I think telehealth is great.
I've had a very different experience with telehealth.
Really?
And I'd love to get your input on this as well, Dr. Eric, because I've used telehealth a couple times when it's just like, man, I really don't have time to like go to the doctor right now. Like, is this really worth it? And every time I've done it, it's been like for a cough. It also recently had hand, foot, and mouth, and just doing telehealth. Every time I do it, I'm just like, hey, I just need like some antibiotics or something. Like just tell me what I can go take to take care of this. I'm not dying. Right. And every time they're like, oh, that looks bad. You should go to a doctor. I'm like, that's what I called you for. Like, I'm trying not to go to the doctor. Like, oh yeah, no, that looks bad. You should go see somebody. It's like, what a waste of like time.
That's terrible and funny.
Yeah. I don't know.
Like, hi, I'm Dr. So-and-so. How can I help you today? You tell them their problem. Wow, you should go to a doctor.
Here, you don't say.
Mechanic, can you take a look at my car? Wow, that car looks messed up. You should take it to a mechanic.
Yeah. That should be a separate app. Like somebody who's not a doctor, maybe a med student could like make an app or something.
One of us. Oh, dude, that looks really bad. You should go to the doctor.
Yes. Should I go to the doctor or should I not?
Put some alcohol on, you'll be good.
Like, oh yeah, that one's okay. Like, you should go to the doctor.
Put some duct tape on it, you're fine.
Just wrap it up, you'll be fine. Then when your parents come in, it's like, hey, my kid's got a fever. Okay, how long has it been? An hour. Okay, stay home. You're fine.
Right.
Put him to bed.
Give him some Tylenol, some ibuprofen. Don't worry.
They'll be okay.
Everything will be okay.
That's always good advice. So, what are like?
What
Eric,
is your
would you
experience
say?
with telehealth?
Oh yeah, your experience with telehealth. Yeah.
So
I used it.
I do not use it, mainly because my office is open 24/7, 365.
Right.
From a physician standpoint, right? All of this stuff has nuanced answers.
Of course.
I hate telehealth. In short, I hate telehealth.
Really?
I think that you cannot make an accurate assessment of the patient. I think that people get unnecessary antibiotics because of it. Now,
okay.
keep in
All
mind,
right.
I come from the new age training, right? I just did 3 years peds residency, 3 years peds ER fellowship. And the modern training varies significantly from even those who were trained 20 years ago. We've as a medical profession realized that we were very much overprescribing antibiotics.
Oh, sure.
For viral infections, and now we have superbugs that are killing people because we were not careful with. Yeah, exactly. Yeah. We were not careful with prescribing antibiotics for the last 30, 40 years. And telehealth, you just, if you're a good doctor, asterisks there. Sorry to any doctors who are listening. If you're a good doctor, you're going to thoroughly examine your patient. And if you're going to actually examine your patient, you can't do it via telehealth. Now, there's some very basic things, pretty much a cold, that you should be able to say, yes, it's a cold. You likely don't have anything abnormal on exam. Like if I were to listen to your lungs, it would probably be clear. Or if you're old enough to tell me that your ears hurt.
Right. That's the big one for me. So
I would say if it's fine if you can make it through telehealth and you don't get antibiotics and say, hey, it sounds just like a viral infection. Here's a plan. If you're not getting any better by this date, you could go see a doctor for an in-person checkup. But if you're getting antibiotics via telehealth, honestly, you're probably not supposed to be getting antibiotics.
Really?
Because most things that you need antibiotics for, you actually need to have a physical exam for to diagnose.
Oh, okay.
So if you're looking at...
it makes sense. Viral versus bacterial,
Yeah, so if you're looking at the two different infections, simplifying things, but two different infections, viral versus bacterial infection. There's also fungal protozoa, but we'll forget about that for now. But viral versus bacterial, 95% of infectious symptoms out there are and they'll last about 7 to 10 days and go away on.
Yes,
yeah, and then bacterial infections examples would be community-acquired pneumonia that you need antibiotics for, which you predominantly you can only diagnose that by listening to a patient or by getting a chest X-ray, both of which can't be done via telehealth.
Right.
Or like an ear infection, although we now know 70% plus of ear infections are actually viral and will go away without getting antibiotics. We're in this new phase of medicine where we're discovering that a lot of things that we used to prescribe antibiotics for actually don't need antibiotics. We're not even sure if, going back to the community-acquired pneumonia, we don't even know if antibiotics work for what we have said are bacterial pneumonias. Again, this is for the pediatric population. I don't know.
Sure.
I don't know much about adult medicine.
Yeah. Well, that's really good to know because for me, like the ear infections used to be a big deal. And it's like, look, I know my kid has an ear infection. I don't want to go sit in the doctor's office and pay you $90 to prescribe me something
to get an antibiotic. Yeah.
Just let me go get the antibiotic. But if it's, maybe it's been viral or whatever. I mean, we just put an above ground pool in our backyard. And that's like now my big thing is like, one, trying to keep that thing clean. What a pain in the butt. But two, like they're going to get in there and something's just going to get in their ear and, some little particulate and we're going to have an ear infection.
When I was growing up, if you were if you were swimming in a lake, you put vinegar in your ear when you got out, and that killed anything that was in it. And if you had an ear infection, you just poured some either vinegar or alcohol, depending on whether it was my grandmother or my mother.
Right. So let's clarify too, right? Let me know if it's too much medical, but I figure that's why I'm here too, right? So there's
people can rewind if they need to hear it again.
Yeah, 2 types of ear infections. One's an outer ear infection that's called swimmer's ear,
Right.
And that's more associated with swimming. And then you've got and those you treat with. You can prevent them, like John said. They form by having bacteria and water get stuck in your ear. So when you go swimming and you get water in your ear, if you don't fully empty it out, or if you put your finger in there and scratch the surface and get some bacteria in there, that can cause an external or outer ear infection, swimmer's ear.
Right.
And all you need is some antibiotic ear drops. You don't need an antibiotic. But when people classically talk about an ear infection, that means a middle ear infection, not an outer one.
Okay.
But a middle ear. And the middle ear infections are what we classically call ear infections. And they always start with a viral infection, almost always start with a viral infection that causes stuffy nose. And then you've got something called the eustachian tube, which is a tube that connects the ear to the nose. When you plug your nose, blow, you can pop your ear. But when that tube gets blocked off by a stuffy nose, because the exit ramp for that tube is in the nose, so when you have the swollen nose and stuffy nose, that exit ramp gets blocked off, you get a traffic jam of fluid back up to the ear. And then stagnant fluid, just like stagnant lakes here, hashtag Florida reference, stagnant lakes breed mosquitoes.
Right.
Same thing, stagnant fluid in the middle ear breeds bacteria. So we think. And that's what causes the middle ear infection that we more classically call the ear infection. So 2 different types of ear infections, an outer ear infection like swimmer's ear that you guys were talking about. But most middle ear infections or your classic ear infections are actually started as viral and then can have a secondary bacterial infection on top.
So when I was a kid and we were told we had an ear infection, my mother brought us home and she would pour vinegar or alcohol into our ears because it's just an ear infection. It's just that every time. And I mean, I didn't have a lot of them. But I would be stuffy and she'd take me to the doctor, which was very rare. And they'd say, "Oh, he's got an ear infection." That's what she did. Tried to get it from the outside. And I'm like, when I was younger, I was like, this can't work because there's a barrier there.
You're right. There's an eardrum there.
Right. There's something in the way. So I'm like, this can't work. But you know what? It always seemed to work. So apparently I have missed something. And like, I don't know if you're aware of this, but I was a paramedic. And I'm like, this shouldn't work. But for some reason it did when I was a kid. And
I think it speaks to why we're now realizing that most ear infections are viral, because viruses will clear on their own. A lot of the time you just start an antibiotic and usually it takes 2 to 3 days for an antibiotic to work. And if you go back and saying, well, what if it was a virus the whole time? Viruses can clear themselves in 3 days or so for ear infections. So you don't know, you don't know whether it was the antibiotic or creating a bacteria or whether the virus would have just cured itself. So if you never took if you had a middle ear infection and you were pouring vinegar in your ear, I agree. There's no medical reason why that should help. It probably just supports our now understanding that most ear infections are viral.
I mean, we didn't
will go away without
antibiotics.
Yeah.
Yeah, it just wasn't something we did. So I've taken more antibiotics in the last year than I had my whole life. I did a number on my finger and they prescribed me antibiotics. So I took those and it was like, okay, now I've taken a whole regimen of antibiotics and I just never used to take them. Even they give them to me and you had your wisdom teeth out. I took them the day before and that was it. I didn't take any more of them. Just, I forgot. So.
Yeah. Yep.
There you have it.
It happens.
It happens.
I have just proven the new medical theories.
You did. Contributing to science.
That's what I do.
Quote the Jage on that one.
Yeah. So now that we've talked about daycare syndrome and why like going to the doctor because your kids have a stuffy nose and a sore throat may or may not be useful. When should you take them to the doctor, and 2, keep them out of school?
So I
We're gonna hold you to this.
would say if you think your child has a cold and it's just nothing out of the norm, you don't have to take them to the doctor. Even if there's a fever. If there's a fever, 3, 4, even 5 days, I'm okay with. Anything, 5 days is where I draw the line at fever, right? Or kind of going back to fever is not an emergency. The times that I actually worry about, not worry, but I at least will think more closely about is fever that goes on longer than 5 days or fever that's higher than 107 and 108.
Then 107?
Yeah. If it's 105, I don't care.
Wait a minute.
Not higher
I've seen
than
Osmosis
105?
Jones.
Mm-hmm. There's only one
I've
patient.
seen Osmosis Jones, and he got up to like 108, and that's when he was going to die, okay?
That's why
Bill
he's
Murray would not lie to
concerned.
me.
Yeah, 107, 108, I'm like, okay, so what's going on here? It makes me think most of the time your body won't generate that high unless it's one of 2 things. One, you're about to die from a serious bacterial infection, like meningitis or whatever. Or most of the time you get 107, 108 is when you have an external source of heat, whether it's you've been locked in a hot car.
Sure.
Or you're out on a football field, and it's an external source of fever than internal. But most of the time, large majority, I'm talking like 99+%, your body will never generate a high enough fever to cause harm to your body.
That makes sense. So the body's trying to protect itself. Why would it?
Well, and actually, there's a small subset of infectious disease researchers out there because fever serves a purpose, right? So for every degree your core body temperature goes up, it actually helps your body fight off whatever infection's going on. The higher temperature makes it harder for the foreign invader to replicate and keep causing problems. So it's actually a beneficial response.
So are you saying that sweating it out is a real thing? Is like a useful thing?
Yeah, and some people are saying we're actually hindering the body's response to appropriately fight viruses by giving Tylenol and ibuprofen.
No kidding.
And some will say don't do it because you're actually harming the body, not harming the body, but preventing the body from
longer.
Yeah, exactly. Your body is set up. God made us perfect to fight infections. And why are we hampering that process? Now, I'm not part of that camp because I have kids, and you feel absolutely criminal when you have a fever. Some kids will stop drinking when they have a fever, and then dehydration is dangerous. You'll end up in the ER if you're dehydrated. So there's a fine line to walk there. I give my kids ibuprofen and Tylenol because 1, I like to sleep at night when they're sick, and 2, I like my kids to stay hydrated, and 3, you feel miserable. Why? I don't have any hard evidence showing that it actually prolongs recovery time by giving Tylenol and ibuprofen. So yeah, my kids get Tylenol and ibuprofen.
That makes sense that the body's designed, that the whole reason behind the fever is to kill the bug. So if you stop it getting hot, it doesn't kill the bug, and it just takes longer. That's the theory. That's the theory. It makes sense when you think about it, but I have no solid evidence to prove that. I would prefer to sleep.
Yeah, I prefer.
Let's let them be a little bit sick for a little bit longer, maybe, and get a good night's sleep.
Exactly.
Oh yeah.
It's like. It's if they've woken up a couple times before I've gone to sleep, I'm going in there at 10 p.m. before I go to sleep, waking them up, giving them some ibuprofen, and saying, "All right, let's make this last the full 6 to 8 hours."
Yes.
Oh man, that's so great! I'm glad that there's a medical professional who thinks that my dosing of my children is appropriate.
Absolutely.
They make medicine for a reason,
Right. Oh, absolutely. Acetaminophen or Tylenol and ibuprofen every 6 hours. You alternate every 3 for more constant fever control. So
I've heard
Oh,
that
yeah.
one too.
That
times
makes
zero,
total
times
sense.
zero is Tylenol. 3 hours later, ibuprofen. 3 hours later, Tylenol. So it's still every 6 hours, but you get more constant fever control that way.
That's a great idea.
So we had a situation in our house, and this is talking about like when do you send them to school, when do you not? So my daughter woke up Monday morning, and she just had this gross cough, like little cough we're okay. And if you go back and listen to our episode before, we were like little cough okay, puking definitely you got to stay home. Like
Right.
you can't get away from that one. Diarrhea, let the school decide. See if it happens. Roll the dice. So she wakes up with this awful cough. Like it just sounded really barky. Like I think croupy is the word that we'll use. And she would do this like she realized if she kind of like giggled, it would just do this really low like kind of like roll of her vocal cords, and it just sounded so gross. And we're like, stop, please don't do that. She thought it was the funniest thing in the world.
I wish we recorded that.
Yeah. And so we're like, crap. Like, what are we gonna do? Like, somebody's gonna have to take her to the doctor. Somebody's gonna have to stay home with her. So we decided to take her to the doctor. The other thing that our pediatric office has is like I think they do every weekday, like 7:30 to like 8:45. They'll do walk-in. Like you can just walk in, sick visit, and they'll squeeze you in when they can, which is great. Like you don't need an appointment. You just walk in, say, hey, this is what we're dealing with. So my wife took her in, and hey, bad cough, sounds terrible. Doctor looks at her and is like, oh, this is like a really minor like throat infection. Like you really don't even have to give her medicine. If you want to, we'll prescribe something, like don't even worry about this. And so we went home. She barely coughed the rest of the day. Like it must have just been some weird like allergy or something. I don't know. Cause she sounded awful.
Right.
Like we were concerned. And then the doctor's like, oh no, this is like no big deal. Like after looking at her, they prescribed some little cough syrup thing. It's like, yeah, just give her like, 5 milliliters once a day. If you want something like that, yeah. We did it once, and then I don't think we even used it again, and she was fine after that.
Huh.
So here's your $40, doctor. Here's your copay. Enjoy that.
Yeah.
So, like, where do you think? Where's that line for you? When are you keeping your kids home? When you recommend the kids stay home?
So there's two answers here, right? There's what the school recommends,
right,
and then what science recommends / would allow, right? And then there's also more moral implications too, right? What are you willing to do? What do you think is socially responsible? And the answer is going to be different for everyone.
Sure.
But there's a pretty big discrepancy between what the school says is okay to come back and what scientifically / morally is appropriate. Schools will usually say fever free for 24 hours or no vomiting and diarrhea for 24 hours. You can come on back. In actuality, most viruses, you're contagious for 5 or so days. So whether that ranges from the little bit of sniffles and mild cough, like you're just mild cold like symptoms, all the way up through influenza, 5 days of fever, vomiting, diarrhea, terrible cough, stuffy nose, rash, full spectrum. But for any virus, you're contagious for anywhere between 3 to 5 days. So even if you have fever on day 1, technically the school says, well, okay, on day 3, you've been fever free for 24 hours, come on back. Well, you're still technically contagious. The school says you can come back. So that's where you get into the social implications is, am I okay with my child being contagious and going back to school?
I kind of wish you didn't tell me that, because now
that's the thing, right? It's going to be different. And what would school look like if everyone kept their children out of school from a scientific standpoint until they were no longer contagious? I don't know. I think half the school population would disappear in one day, and you'd never have a full classroom, because kids are always going back to daycare syndrome. It's either in daycare or it's in school. It's the same. It's a bunch of kids, snotty kids, sneezing and coughing and not being good at hand hygiene and stuff, which is what kids do. It's not their fault. Not their fault.
I don't understand. I do not comprehend why my kids hate washing their hands.
Oh, my kids love washing their hands.
My kids hate washing their hands. They will throw themselves on the floor after they go to the bathroom because we're like, hey, you have to flush. You have to wash your hands.
No, see, the problem we have.
What do you think is going to happen?
Problem. They get up there and they play in the water for 20 minutes.
Are you taking a bath in the sink? What are you doing?
Seriously. You're cooking
insane.
dinner, the kid goes to the bathroom, and like 10 minutes later you hear splash, splashing. What are you doing in there?
I don't know. I almost wish we had that problem. It's like, dude, just wash your hands. Like,
well, the problem is when they need to. Last night, my oldest we're eating dinner, and her hands are covered in marker and dirt, and just look disgusting. I'm like, you should probably go. And I try to do like the suggestion, not like tell them you have to go do this, because if you tell them, then you meet resistance. But if you suggest it, then sometimes it works. And last night it didn't work. Last night she's like, "No, I don't want to." And it's okay, just saying,
I feel like it's almost the other way. And that's a question I think we'll have to go back to talk to Anna about. The psychology of it, because my wife calls me on all the time. Like, I'll say, "Oh, let's go wash our hands, okay?" And she's like, "No, don't say okay. You're giving them the option not to."
Right.
That
makes sense.
Oh, okay. Like, no, we're gonna go wash our hands now. Okay? No.
Good chat.
Yeah. But it's always like when they literally have poop on their hands and they're just like, what's the big deal? Like, I'm just going to go in the fridge and get a cheese stick. Like, no. And I don't, that's one of my not great parenting moments because that's just, I became a real germaphobe in the last 2 years. I don't know why. I guess being a parent will do that, but.
Yeah, being a parent in a pandemic.
Right.
Yes. Yeah. Well, and we had COVID recently. That was our last published episode. And my mom also tested positive, and we're both like, we both felt fine. Like, it wasn't a big deal, but we didn't want to spread. And so we're just like, we're looking for the loophole, man. Like, 5 days, unless you feel okay, then just do your whatever you want. I had to tell my mom, like, hey, it's not a rule. Like, wear your mask,
They're more what you call guidelines than actual rules.
Yes.
Yeah. There's definitely, it's the more recent strains have not been making people as sick as Alpha and Delta. I'd say this year, this is anecdotal, meaning it's just my experience. It's much better when you're looking at scientific evidence to get the really big studies that look at everyone everywhere rather than just one random doctor on the Dad Shoes podcast telling you what he's seen this year. But flu's made kids really sick, and I have not seen a really sick COVID case since, the Delta variant, honestly.
Wow.
That's really good to hear, because we had it. I had COVID confirmed, I think, just once, but I've been exposed to it a bunch, and and we were terrified. Like the original strain, it wasn't really affecting kids. I wasn't too concerned. I was more concerned about them getting sick, getting better, and then having like the long COVID symptoms down the road. And
at that point, we had no idea what the long-term consequences of COVID. We knew nothing about it. It was weird seeing science in action. But you had no idea what was going to happen.
And so that was my biggest concern. And then it started affecting kids. And that was where I started getting a little bit concerned. So I got sick, or my wife got sick. And then she was positive. The rest of us were negative. And then the next day, the baby got sick. She tested positive. So then the 4-year-old and I slept in the same room and put the other two in their room. And then I got it. And then I tested positive. So now it's like, listen, you're on your own, kid. You're only 4, but we're going to wear a mask around you. Don't go near your sister, None of that
When
stuff.
I was 4, I survived on PB&J sandwiches for a month.
If only she'd eat the PB part.
Well, we had it. We managed. It seems we did not spread it to the kids. Either that, or we just didn't shove that thing up their nose far enough. It's also very possible. They fought us every time. But you
That
know, we
should be
put
an
our
Olympic
masks on,
sport.
and oh my
Like
gosh,
I just want to see like the next Olympics. You've got like all the classic ones, and the next up, parents trying to COVID swab their children.
yes. I would watch that. I want to see that happen. My son was so funny about it because he's trying to haggle, you know, and we're just like, hey man, we got to take a booger test, all right? And
Booger test.
I gotta check your boogers and see if you're sick. And he'd be like, okay, I understand. Not right, not yet. Let me go sit on the couch, and then move. All right, go move under the couch. Oh, no, not right now. Hold on, let me get ready. Hold on. And he would just do that for like 15 minutes.
Instead of like 3/4 of my nose, could we kind of deal with like half
he's
inch
like
of
right
my
here,
nose or a quarter
right
inch
here?
of my
Can you
nose?
just do it right here? Like no, we got to go a little farther than that. Yeah. Just give my swab my upper lip. No, we got to go a little farther than that. So now, I don't want to turn this into the Joe Rogan podcast, but are either of your kids COVID vaccinated?
Yes, both my kids are. We have gotten one dose for each of them, and we are coming up on the whole move kind of put us behind on our COVID vaccination because we didn't have a pediatrician for a while. And then you finally get insurance with the new job, and then it takes 3 months to get in with the pediatrician, and then they only have COVID vaccines on X day. So we got behind it. Exactly. So my kids have only gotten one. And I am hoping for some updated CDC guidance since we are now not seeing very many side effects from actual COVID infections. Back with the Alpha and Delta variants, it was much more important. Not saying that it's not important to get vaccinated now. Don't get me wrong on that, but we had really good things we were preventing because multisystem inflammatory syndrome in children, MISC, if you guys ever remember hearing about that, the really bad post-COVID. It was associated with COVID, but it happened about a month afterwards, and kids came in and they were really, really, really sick. I'm talking like life support for weeks in the ICU, that sort of thing.
That's intense.
So, and vaccines were preventing that. And severe lung damage associated with Delta was, vaccines were also preventing that. Now that the strains have become less virulent, I'd like to see a more updated study comparing the current benefits and disadvantages of vaccination with the current strains versus the original strains.
So,
but yes, my kids are at least partially vaccinated for COVID.
You brought something up, and I was actually going to say how mine aren't because I'm a terrible person and just slack on it. But there was something, and this isn't necessarily related or pertinent to anything, but in like late summer, early fall 2019, there was this thing going around. We saw it a lot in I remember specifically in England, and I think in Europe, and I know we had some cases here. But it was this extreme inflammatory symptoms specifically in children under 8, like in younger kids. But it was exactly what we saw. I think it was last year in 21 with the post-COVID symptom. But this is in 2019 before COVID ever hit, and I don't know if you remember hearing about that at all.
I don't remember hearing it. There's really two major entities. Well, actually, before MISC existed, it was only one called Kawasaki disease, and that may be what you're referring to, John. I don't remember hearing anything about 2019. I'd have to look it up. But when COVID first started, we started seeing we're seeing a lot of kids come in with Kawasaki disease, which is this really bad inflammatory response. So we started treating it, and we thought it was Kawasaki, so we were treating it like Kawasaki, and kids were getting better. And then a bunch of smart researchers said, hey, actually, all these people, it doesn't look like this is classic Kawasaki disease. There's labs that are a little off, they're presenting differently, and they tied it. They did all these tests, and every single one of these patients had an immune response to COVID. And thus MISC was born, and the treatment for it was kind of just continued for Kawasaki. So it was kind of accidental that we discovered the treatment for MIS-C because we were treating it like it was the only other disease that we knew about before it.
So
but it may have been, it may have been Kawasaki that you're referring to.
Well, it was an outbreak, and it may be. I don't know why, but it's possible I'm thinking it was before COVID, but it's now been going on for 3 years, so it just was COVID.
There was also a strain of adenovirus that was causing liver failure. Was it adeno? It was either adenovirus or enterovirus, but it was a bad strain that got national attention. That put it's just a viral infection that put a lot of kids into liver failure.
Yeah, because it was like they didn't know what it was. I remember Kawasaki disease was something, but it's not this is what I remember. Anyways, I don't remember. I guess you don't know what, don't remember it, and that's cool. That's totally fine. That's totally fine.
Thank you for listening to our first episode with Dr. Eric George. Be sure to tune in next week for the continuation and finalization of this conversation. We are in regular contact with Dr. Eric, so if you have any questions you would like us to ask our friendly neighborhood podcast doctor, just reach out to us at dadshoespod or email us at dadshoespod@gmail.com. Thanks for listening. Bye.